Breast cancer is one of the most common types of cancer affecting millions of women around the world each year. In fact, did you know that 1 in 8 women will be diagnosed with breast cancer in their lifetime? That means, at some point, this could affect someone close to you, your mother, your sister, your best friend. But here's the good news. Early detection can make a world of difference. If caught early, breast cancer is far more treatable and survival rates are much higher. So, how do you spot the signs, and what can you do to reduce your risk of developing this disease in the first place? Whether you're just starting to learn about breast cancer or want to refresh your knowledge, this guide will walk you through the common symptoms to look for and simple, actionable steps you can take to protect your health. Let's dive in. Understanding breast cancer. A quick overview. Breast cancer occurs when the cells in the breast begin to grow uncontrollably, forming a lump or tumor. Our breasts are made up of several types of tissue, including milk-producing glands, ducts, and connective tissue. When a cancerous tumor develops, it typically starts in one of these areas and may spread to nearby tissues. The good news is, breast cancer is often treatable when caught early, which is why understanding the disease and recognizing the symptoms is so important. While it is often thought of as a disease that only affects women, men can also develop breast cancer, although it's much less common. In fact, less than 1% of all breast cancer cases are diagnosed in men. Breast cancer is a complex disease, and there are different types based on where it begins and how it behaves. The two most common types are invasive ductal carcinoma, IDC, and invasive lobular carcinoma, ILC, both of which start in the milk ducts or milk-producing glands. It's important to understand that not all lumps or changes in the breast are cancerous. Many women experience benign conditions that can cause similar symptoms, such as cysts or fibrocystic changes, which are non-cancerous. However, the key takeaway here is that any unusual changes in the breast should be monitored and checked by a doctor. Early detection is vital. Breast cancer has a much better chance of being successfully treated when it is caught in the early stages. Recognizing the symptoms of breast cancer. One of the most crucial steps in fighting breast cancer is recognizing the early warning signs. While not all changes in the breast are cause for alarm, being aware of potential symptoms can lead to early detection, making treatment more effective. Below are the most common symptoms that may indicate the presence of breast cancer. 1. Lump in the breast or underarm. The most common sign of breast cancer is a new lump or mass in the breast or under the arm. These lumps are often hard, irregularly shaped, and painless, though some may be tender. It's important to note that not all lumps are cancerous. Many are benign cysts or fibrous tissue, but any new lump should be evaluated by a doctor. For easy comparison, think of a lump that feels like a marble or pea. If you find one, get it checked out, even if it isn't painful. 2. Changes in size, shape, or appearance of the breast. Breast cancer can cause changes in the size or shape of the breast. One breast may appear larger than the other, or there may be visible changes in its shape. In some cases, the skin over the breast may look dimpled, resembling the texture of an orange peel. This is known as peau d'orange and is a sign that something could be wrong. Any change in appearance should be noted and shared with your doctor. 3. Pain or tenderness. While not all cases of breast cancer cause pain, some women experience discomfort or tenderness in their breast tissue. Pain that doesn't go away or is different from your usual menstrual discomfort could be a warning sign. If you experience persistent breast pain, especially in one specific area, It's important to seek medical advice. 4. Unexplained nipple discharge. Nipple discharge, particularly if it is clear or bloody, can be an indication of breast cancer, though it can also be caused by non-cancerous conditions like infection or hormonal changes. Any unusual discharge from the nipple should be evaluated. Discharge that comes from one nipple, especially if it's blood-stained, is particularly concerning. 5. Skin redness or irritation. Skin changes over the breast, such as redness, rashes, or puckering, are another symptom to be aware of. These changes might appear similar to an irritation or infection, but they can be linked to inflammatory breast cancer, a rare and aggressive form of the disease. In this case, the skin may feel warm to the touch and become swollen. If these symptoms persist or worsen, seek medical attention immediately. In conclusion, while many of these symptoms can also be caused by non-cancerous conditions, it's crucial to consult a healthcare professional if you notice any of them. Early detection plays a critical role in successful treatment, so don't hesitate to act if you observe any of these warning signs. The next section will explore the ways you can lower your risk of developing breast cancer, so stay tuned. Prevention strategies. How to reduce your risk of breast cancer. While it's impossible to eliminate all risk factors, there are several proactive steps you can take to reduce your likelihood of developing breast cancer. Adopting a healthy lifestyle and making certain preventative choices can significantly lower your risk. Here are some of the most effective strategies. 1. Healthy lifestyle choices. One of the most powerful ways to prevent breast cancer is by maintaining a healthy lifestyle. This includes eating a balanced diet rich in fruits, vegetables, and whole grains, while limiting processed foods, sugary snacks, and red meats. Studies have shown that diets high in fiber, antioxidants, and healthy fats can support overall health and reduce cancer risk. Also, staying hydrated and limiting salt intake can improve your general well-being. Along with nutrition, regular physical activity is essential. Aim for at least 30 minutes of moderate exercise 5 days a week. Exercise helps regulate hormone levels, maintain a healthy weight, and boost your immune system, all factors that can lower the risk of breast cancer. Even a brisk walk every day can make a difference in reducing your risk. 2. Limit alcohol consumption. Excessive alcohol consumption is a known risk factor for breast cancer. Studies have shown that the more alcohol you drink, the higher your risk of developing the disease. For women, it's recommended to limit alcohol intake to no more than 1 drink per day. By cutting back on alcohol, you not only reduce your risk of breast cancer, but also benefit your overall health. 3. Breastfeeding. If you are able to, breastfeeding has been shown to lower the risk of breast cancer, especially if done for a longer duration. The hormonal changes that occur during breastfeeding help prevent cancerous growths. Additionally, breastfeeding helps you maintain a healthy weight and promotes bonding with your baby. 4. Regular screenings and self-exams. Perhaps one of the most important preventative measures is to stay on top of regular breast cancer screenings. Mammograms, which are X-ray images of the breast, can detect abnormalities even before you can feel them. Women should begin getting mammograms around the age of 40, though some may need to start earlier if they have a family history of breast cancer or other risk factors. Along with professional screenings, performing monthly self-exams is crucial. A self-exam involves gently feeling your breasts for lumps or changes in shape or texture. By becoming familiar with your own breast tissue, you can more easily notice any changes and seek medical advice early. 5. Be aware of genetic risk factors. If you have a family history of breast cancer, or if you carry the BRCA1 or BRCA2 mutations, you may be at a higher risk for developing the disease. Genetic testing can help identify these mutations, and if you are at a higher risk, your doctor may recommend additional preventative measures, such as earlier screenings or medications that can reduce risk. By making these simple lifestyle adjustments and keeping up with screenings, you can significantly lower your risk of developing breast cancer. In the next section, we'll dive into the importance of early detection and how screening can save lives. The importance of early detection, how screenings save lives. Early detection is one of the most powerful tools in the fight against breast cancer. When detected in its early stages, breast cancer is much treatable, with a higher likelihood of successful treatment and recovery. This is why it's crucial to take advantage of breast cancer screening and be proactive about your health. Regular screenings can help catch the disease before any symptoms appear, allowing for earlier intervention. Mammograms and regular screenings. A mammogram is the most common and effective screening method for breast cancer. It involves taking an X-ray of the breast to detect any abnormalities, such as lumps or calcifications, that may indicate cancer. For most women, it is recommended to begin annual or biennial mammograms starting at age 40. However, if you have a family history of breast cancer or certain genetic markers, your doctor might recommend starting earlier. Mammograms can detect breast cancer before it can be felt, often when it is at its most treatable. Clinical breast exams. In addition to mammograms, clinical breast exams are another vital part of early detection. These exams are performed by a healthcare provider who will physically check the breast for lumps, changes in shape, or other abnormalities. It's typically recommended that women have a clinical breast exam every year starting at age 40. For younger women, exams may be suggested depending on risk factors such as family history or previous diagnosis of breast conditions. Self-exams, knowing your body. Self-exams are another essential part of breast cancer prevention. While they are not a substitute for professional screenings, performing a monthly self-exam can help you become familiar with the normal feel and appearance of your breasts, making it easier to notice any changes. Self-exams are easy to do at home and should be performed after your menstrual period ends, when your breasts are least likely to be swollen or tender. If you notice anything unusual, such as a new lump, pain, or skin changes, it's important to contact your doctor right away for further evaluation. Early diagnosis saves lives. The earlier breast cancer is detected, the better chance for successful treatment. Early-stage breast cancer is often confined to the breast tissue and has not spread to lymph nodes or other parts of the body. Treatment options for early-stage cancer are typically less aggressive and can include surgery, radiation therapy, and hormone therapy. The survival rate for breast cancer is the highest when the disease is found in its earliest stages, making regular screenings and self-exams essential. By staying on top of your breast health with regular screenings and self-checks, you can catch any potential issues early when the disease is most treatable. Early detection truly can save lives, so don't wait until you notice symptoms. Get screened regularly. In the next section, we'll review some practical steps you can take to prevent breast cancer before it even starts. Conclusion: take charge of your health today. When it comes to breast cancer, knowledge is power. Recognizing the symptoms early, understanding how to reduce your risk, and getting regular screenings can dramatically improve your chances of detecting the disease in its early, most treatable stages. It's not just about avoiding cancer, it's about living a healthier, more informed life. We've covered several key points in this guide: how to spot early symptoms such as lumps, changes in breast shape, and unexplained pain; how lifestyle choices like exercise, diet, and alcohol consumption can reduce your risk; and the critical importance of early detection through screenings like mammograms and self-exams. These steps are simple but effective ways to protect your health and catch any potential issues before they become serious. However, it's important to remember that while these measures can significantly reduce your risk, they are not a guarantee. That's why being proactive is so important. Don't wait for symptoms to appear before seeking help. Regular screenings and checkups are your best defense, as they help catch the disease early when it is most treatable. Before we wrap up, I want to hear from you. Have you experienced any of the symptoms mentioned earlier, or is there another health concern you're worried about? Comment below with your thoughts or questions. I'll respond to each of you or even address your concerns in the next video. Together, we can learn how to handle health issues effectively and ensure that we and our loved ones can live healthier lives. Don't forget to like this video and share it with your friends and family so they too can benefit from this important information. Let's work together to stay informed and take control of our health. Bonus section: frequently asked questions about breast cancer and prevention. As you continue to learn about breast cancer and its prevention, it's natural to have questions. Many people are confused by the myths surrounding breast cancer or unsure about what they can do to protect themselves. To clear up some of the common misconceptions and provide further insights, here are answers to some of the frequently asked questions about breast cancer and prevention. Will wearing a bra cause breast cancer? This is one of the most widespread myths about breast cancer. Some rumors suggest that wearing a bra, especially an underwire bra, can cause the disease. However, there is no scientific evidence linking bras to breast cancer. Breast cancer occurs due to changes in breast tissue or genetic mutations, not because of the clothes you wear. So, feel free to wear what makes you comfortable without worrying about increasing your cancer risk. Does breast cancer only affect women? While breast cancer is far more common in women, men can also develop it, though it is much rarer. Men have small amounts of breast tissue, and although they are less likely to get breast cancer, it can still happen. Male breast cancer is often diagnosed later, so it's important for men to be aware of the potential symptoms such as a lump in the chest or changes in the nipple area. Can I prevent breast cancer completely? Unfortunately, there's no guaranteed way to prevent breast cancer, as some risk factors such as age and genetics are beyond our control. However, by adopting a healthy lifestyle, eating a balanced diet, staying active, limiting alcohol consumption, and maintaining a healthy weight, you can significantly reduce your risk. Regular screenings are also crucial for early detection, which plays a vital role in successful treatment. What if I have a family history of breast cancer? Having a family history of breast cancer does increase your risk, but it doesn't mean you will definitely get it. If you have a family member who was diagnosed, talk to your doctor about your personal risk. They might recommend earlier screenings or genetic testing to see if you carry any inherited mutations, such as the BRCA1 or BRCA2 gene, which increase your risk. Can I do anything to reduce my risk after menopause? After menopause, women's breast cancer risk increases partly due to hormonal changes. However, maintaining a healthy lifestyle by exercising regularly, managing your weight, and limiting alcohol intake can help mitigate some of these risks. Additionally, some women who are at high risk might consider preventative treatments, such as medications, to reduce their risk. How often should I get screened for breast cancer? For most women, it is recommended to begin getting mammograms at age 40 and to continue annually or biannually, depending on personal risk factors. However, if you have a family history of breast cancer or are at higher risk, you might need to start screening earlier. Speak with your doctor to determine the best screening schedule for you. By understanding these frequently asked questions and dispelling common myths, you're taking one more step toward protecting yourself and others from breast cancer. The more informed we are, the better equipped we are to prevent, detect, and treat this disease. In the next section, we'll provide additional resources to help you take further action in safeguarding your health. Stay tuned.